Persistent challenges of lead exposure in children, emerging sources and prevention strategies. Introduction. Despite stringent regulations aimed at mitigating lead exposure from traditional sources such as paint, gasoline, and plumbing, recent incidents underscore the ongoing risk posed by lead in everyday products. Notably, a federal investigation linked over 500 cases of elevated blood lead levels to contaminated cinnamon applesauce products, prompting widespread recalls. This situation highlights the critical need for continuous vigilance and proactive measures to protect vulnerable populations, particularly children, from lead toxicity. Current landscape of lead exposure in children. According to the Centers for Disease Control and Prevention, CDC, approximately 500,000 children in the United States have blood lead levels at or above the reference value of 3.5 micrograms per deciliter, UGDL. This statistic indicates that, despite significant progress in reducing lead exposure over past decades, a substantial number of children remain at risk. Emerging sources of lead contamination. Recent findings have revealed that certain food products can be unexpected sources of lead exposure. For instance, the contamination of Wanabana cinnamon applesauce pouches with elevated levels of lead and chromium led to a nationwide recall. Investigations suggest that lead chromate, possibly used as a color additive, was detected in the cinnamon sourced from the manufacturer in Ecuador. This incident underscores the necessity for rigorous quality control and monitoring of imported food products to prevent similar occurrences. Health implications of lead exposure in children. Lead exposure is particularly detrimental to children under 6 years of age due to their developing nervous systems and higher absorption rates. Even low levels of lead can result in cognitive impairments, attention deficits, and behavioral issues. Symptoms of lead poisoning in children may include fatigue, irritability, developmental delays, and learning difficulties. Notably, these symptoms can be subtle and easily overlooked, making early detection and intervention crucial. Preventive measures and recommendations. To safeguard children from lead exposure, consider the following strategies: regular screening. Consult healthcare providers about routine blood lead level testing, especially for children residing in high-risk areas or older homes with potential lead-based paint. Stay informed on recalls. Keep abreast of product recalls and safety alerts issued by regulatory agencies such as the Food and Drug Administration, FDA, to avoid consumption of contaminated items. Maintain a lead-safe environment. For families living in older residences, ensure that any deteriorating paint is promptly addressed and consider professional assessments for lead hazards. Promote a healthy diet. Adequate intake of calcium, iron, and vitamin C can help reduce lead absorption in children. Practice good hygiene. Encourage regular hand washing, particularly before meals, to minimize ingestion of lead-contaminated dust or soil. Conclusion. The resurgence of lead exposure cases linked to everyday products highlights the persistent challenges in eradicating this public health threat. Continuous vigilance, informed awareness, and proactive preventive measures are essential to protect children from the insidious effects of lead poisoning. Collaboration among regulatory bodies, manufacturers, healthcare providers, and families is imperative to ensure a safer environment for future generations.